Joining us for more on more strategies to flattening the curve and the rising figures is Dr. Bakia Yusufu, a medical officer in Isolo, Lagos. We'd like to welcome you to the program.
Thank you for having me.
I'd like to get your thoughts on perhaps, the news coming in from Kano, news of allegations of death, and then you had the clarification from the deputy COVID-19 response team in the state. What are your thoughts on what's happening? And seeing also that Kano is recording more cases now. We have 73 confirmed cases of COVID-19 there.
Well, considering the current situation and pandemic of COVID-19, I think deaths in such large numbers really have to be investigated as a matter of urgency, because we would not want to give that position whereby people are just being exposed unnecessarily to this disease. And so it's best, they treat it with such urgency.
And that's also another area the NCDC DG has talked about, the processes, the logistics, and the process of taking the samples also for testing and getting that right. But let's come to Isolo, where you operate. Tell us about what's happening there and the healthcare facilities there.
Okay, presently in Isolo LCDA, we are actually undergoing what we call the active case search now, both the society-based, that's the community-based, and facility-based. So presently what we do is to go to private facilities and check through their records for any cases of cough, difficulty in breathing, and sore throats, symptoms that are similar to that of COVID-19 in the previous month, and then follow them up and see if there has been any improvement and if there's a need for testing for them. Also, on the community-based surveillance, we have volunteers who have been going to, door to door and asking these questions, whether we'd find those who are sick or those who have actually died for some reasons we do not know, and get their information and also try and see if we can test them for it. Then we've been doing an ongoing contract tracing right from the day we had the first case. Because of the proximity of the local council to the Muritala Mohammed Airport, we have had to be on our toes at all times to ensure that we don't have high numbers of confirmed cases in Isolo LCD.
Well, we have some of the positive cases coming from the local government. Well,
presently, because it's an LCDA, we just have some 2 or 3 confirmed cases. But they are doing well, and we're glad that we haven't recorded any deaths from it.
How favorable has the case searches been? What successes have you recorded? Have people been receiving, members coming in to check and ask these questions?
Yes, we've been having mixed feelings about our community case search. For some members of the community, they do understand and appreciate the extent this disease has to be checked, and they welcome the volunteers. But on some other hand, we have people who are quite hostile to the volunteers, and they end up chasing them out of the streets of their houses, and that's kind of, makes it difficult for us to actually achieve what we intend to achieve.
But so in areas like that, what's the next thing to do going forward?
Because we already have a team that has been put in place at the local council level, is the emergency preparedness team. So once we have such responses, we just go back to the team and strategize on how we can actually go back there and speak to them and make them understand that, look, we need to have this case search done. And sometimes they oblige, but sometimes it's we're being met with a lot of violence at the end of the day.
So we're also looking at a case maybe that some parts of society might also have this stigma about what COVID-19 is, or perhaps it's a lack of proper sensitization, do you think?
Well, I could say the awareness, it's still a bit low, because people aren't believing that we have COVID-19 cases recorded amongst us. But I believe if we kind of are more open, especially at the community level, based on community cases that are actually being recorded, and they are being, broadcasted to them, probably they might think it's real, because they still have this belief that it's not real, and then we're just formulating some things that are in there. But I think with that, and also if we have people who have actually been cured come out to actually talk about it, it will reduce the level of stigmatization that we see from this.
All right, we appreciate your time, Dr. Bakia Yusufu. Thank you for joining us on the
Thank you for
program.
having me.